watching Let's Chat.
It's always great when someone, especially in the medical profession, that grew up here, goes away, perfects their craft, and comes back home to practice. And that's the case in point with our next guest. It is Dr. Julie Adams, and she is with the Erlanger Medical Group. Dr. Julie Adams, first time here on the show. We're glad to have you here.
Thanks for having me.
A little bit about your backstory. As I mentioned, you grew up here and then went to this little place up in Minnesota for several years to practice, right?
Yes, sir. I grew up in Chattanooga, in Hixson, actually, and then went to medical school in Alabama, and then at the Mayo Clinic for residency. Did a fellowship in hand and upper extremity surgery in Philadelphia, and then practiced in Minnesota for the last 11 years. First at the University of Minnesota and then at Mayo for the last 5 years.
Mayo Clinic, and now she's back here. That is certainly a blessing for our community. Tell me about the scope of your practice. You do a little more than hands.
Yes, hand surgeons often do hand, wrist, elbow, sometimes even shoulder surgery. We're trained in diagnosis and evaluation and treatment of those conditions, which can include surgical treatments as well as non-operative treatments. And my practice in particular is focused on hand, wrist, and elbow trauma and reconstructive conditions, as well as degenerative conditions, both in adults as well as kids.
That's got to be a lot more complicated than it sounds. I mean, you've got, what, almost 24 bones in the hand. That doesn't count the wrist, and then going up to your elbow. And your work area, if you're in surgery, kind of small, right?
That's true. Sometimes we use special glasses to help us visualize structures, particularly nerves or small blood vessels. Sometimes we use an operating microscope. Hand surgery is one of the great specialties because we get so much variety and so many different age groups and so many different conditions we treat. Nerve conditions, tendon conditions, soft tissue conditions, as well as bony problems and joint problems.
Having had hand surgery 2 or 3 different times at Erlanger over the years, I certainly have an appreciation for what you do. And until you actually have a hand injury or something goes wrong, you kind of take the hands for granted.
Yes, and many of our patients have degenerative conditions that may have bothered them over time or come to attention after an acute injury. And some patients have an acute injury that before that things were completely normal. And all of us need our hands, and our patients remind us of that. And a hand surgeon's job is to get a patient back to doing the things they need to do and the things they love to do.
We are happy that you are back home here in Chattanooga and at Erlanger Medical Group. Let me tell you how you can get in touch with Dr. Julie Adams at Erlanger Orthopedics, 778-6784, again 778-6784, or at erlanger.org. Dr. Julie Adams, thank you. We look forward to having you come back, not only for this show, but for our early morning broadcast as well.
Thank you, sir.
Welcome home.
Thank you.
We got to run. We'll see you back here tomorrow morning at 10 for more Let's Chat.